The only remaining abortion clinic in Missouri says it won't comply with a reinterpreted state regulation to give women a pelvic exam at least 72 hours before an abortion. Doctors call the exams medically unnecessary. Critics say it's an attempt to discourage women from going through with abortions. CBS News broke this story, and Meg Oliver is outside Planned Parenthood in St. Louis. Meg, could this result in the clinic being shut down by tomorrow?
Anthony, that remains to be seen. We obtained a copy of the state's inspection report that's more than 60 pages long. Planned Parenthood will file their response today. The medical director here told me that requiring a woman to undergo an additional procedure that he believes to be unethical was the last straw.
How hard was it for you to make this decision to have an abortion?
This is most definitely one of the hardest decisions to make.
This woman, who doesn't want to be identified for her own safety, says she can't support a child, and her misery has only been extended by the additional pelvic exam she had to get days before her abortion.
I feel that the pelvic exam is just another way for them to deter you of a decision that you already know you want to make.
The Planned Parenthood clinic is at the center of a national abortion debate. Missouri has some of the strictest state regulations on abortions, and a recent inspection reportedly cited the clinic for 30 deficiencies. David Eisenberg is the medical director.
It is exhausting.
He says in May, the state reinterpreted an existing regulation requiring his staff to perform an additional pelvic exam.
I have new evidence to say that 100% of the patients who I've taken care of who've undergone this inappropriate, medically unnecessary, and unethical pelvic exam have been harmed by that.
The clinic plans to file a letter in court today stating that unless medically indicated, they will no longer require patients to undergo a pelvic exam at least 72 hours before an abortion.
I'm no longer willing to practice medicine that way.
Even if it means your clinic gets shut down?
I really hope that we get to continue to provide that high-quality, patient-centered care for years to come. The decision now rests with a judge.
The Missouri Department of Health and Senior Services didn't respond to our request for comment. Its director previously defended pelvic exam requirements for abortions as very much a part of standard care, saying the department is trying to ensure the safety of women. But the American College of Obstetricians and Gynecologists says routine multiple pelvic exams for women seeking abortion care are unwarranted, invasive, and not supported by evidence.
They're going to have an exam done when it's medically appropriate, but not at any other time, because to do so, in my opinion, is just assault.
This comes at a delicate time for this Planned Parenthood clinic, which has gone to court over the state's refusal to renew its license to perform abortions. They could rule on that as early as tomorrow. Gayle?
A lot of people are watching. Thank you very much, Meg. We remember when Dr. Lena Wynn was here.
Yep.
Who's now the head of Planned Parenthood. A lot is at stake, and she makes a very important case that, you know, Planned Parenthood is so much more than just abortions.
Yes, it's a very small part of what they do.
Yeah, I think people forget.
It seems like the days of just getting along and going along there are over. They're inviting a challenge here.
Yes, they are.